Despite widespread belief that treating symptoms with medication is beneficial, doing so frequently hides the symptoms of underlying medical conditions. When doctors write a prescription, they can be certain that it won't negatively interact with any other drugs the patient typically takes. Hence, if a patient abuses or misuses their prescription, they run a higher chance of experiencing serious medical effects. Our correspondent, Karen edits, has more.
Taking the wrong prescription and making a mistaken diagnosis are two potential hazards of self-medication. In some cases, poor dose or prescription misuse might lead to harmful drug interactions. Self-medication can be harmful, cause a number of issues, and be unhealthy.
Take Nigeria as an example. We are addicted to self-medication, especially, let me say, because of influence or because we've been on a kind of treatment before and we feel when we come up with it again, I know what I used then, so I should still use it now. So my perspective about self-medication is, firstly, it is wrong. It's not supposed to be, because we are all diverse, like different. The fact that a neighbor came up with this kind of disease and he used a specific drug to treat it doesn't mean if I come up with such a disease, I should also use such medication. Because for every medication, even the common paracetamol, there are side effects to it. There is no drug without side effects. And if an individual has an underlying condition which prohibits such a person from using a type of drug, the person will eventually again break down instead of recovering. So it is best for an individual to first seek medical advice from professionals before taking in any drug.
Self-medication is common in small-scale forms, such as taking over-the-counter pain relievers for headaches, without visiting or communicating with a healthcare provider. Many people self-diagnose a medical issue and then start self-medication in the hopes of alleviating their symptoms, but it can turn deadly if it involves harsher substances or ongoing medication used without a doctor's prescription.
When we talk about drug abuse, it is like a kind of consistent use of a drug over and over again. Yes, we might not term it, it is not, when it is extreme, we call it addiction. But when you abuse a drug, that means it is a custom for you to use it when you come up with a kind of disease. For example, let me say, maybe I'm a kind of person that I come up with flu, like cold, almost all the time. And I already know that anytime I come up with that, I should maybe use Piriton or Loratadine. And consistently every month I come up with cold or flu and I use that same over and over again. That is drug abuse. And it will get to a time that your body will no longer respond to the drug because the body system is already used to it. That is drug abuse. But when we talk about self-medication is just the use of drug without being prescribed by a medical professional.
Although many people believe that taking medicine to treat symptoms is advantageous, it frequently masks the symptoms of an underlying medical condition. When healthcare providers prescribe drug, they often ensure those medicine does not interfere with any other medication a patient usually use, as the risk for serious medical consequences can increase, resulting to nausea, convulsions, and death.
For people about self-medication is to always, visit either a primary care center, secondary or tertiary care center, depending on the level of the medical condition or disease they are coming up with, before getting to buy any drug from the chemist. The fact is, even sometimes the personnel attending to people in most of these chemist shops are not even certified. So there's all probability of them just giving you a wrong prescription, even if the drug you want to procure is the right one. So the overall advice is to always seek a medical personnel to give you the prescription for every condition, for every disease or illness any individual wants to treat.
Therefore, it is important to always seek medical attention to make a precise diagnosis and recommend treatment to reduce potential dangers. Karin Edet, reporting for KAFTAN TV News.